Dear friends of the new health, at some point there will come a moment you might regret eating a lot of gummy bears and brushing your teeth very little. We have toothache and then possibly without pain pills, but there is hope too. And I'm very happy to be able to welcome today Arthur Trankel and Pierre Zeberg. You already know them. We are now in our outdoor studio in Mallorca, and I would like to say a warm welcome to an exciting series of interviews on the subject of dental health. Arthur Trankel, you are an entrepreneur, researcher, visionary in the field of high frequencies. On your travels to Russia, you discovered a frequency device based on the physicist Nikola Tesla, and thus have amazing results to show. We'll talk about it in a moment. And Pierre, you are a health researcher and coach in your practice, the Cell Energy Centre here in Mallorca, and you've gained valuable experience with high-frequency energies. Let's talk today about these experiences and treatment options, specifically on the subject of dental health. Arthur, can I save myself a visit to the dentist if I have your device, or what does it look like?
Well, that's a good, interesting question. The question is, what does the dentist do? What options have the dentist have? And for that, I may have to tell a story from the past. We had a partner in China more than 5 years ago, and he has an alternative clinic where they treated people who had ulcers, tumours, and then Professor Hu asked whether this high-frequency technology can also be used in cancer of the tongue. There's actually nothing against it. They've used this for several months, and after 3 months, he sent us a photo, which we couldn't explain at first because in the photo...
Let's take a look at that.
Exactly, the photo shows an oral cavity that was the prerequisite at the beginning, where the treatment took place on the tongue. And after 3 months, the teeth had become brighter, had become whiter. And the doctor asked us, why are the teeth getting brighter through high-frequency treatments after 3 months, 30 to 45 minutes every day? And then we talked with our specialist, with our chemist, biochemist and pharmacist, Wolfram Kurtz, and he said it's actually quite logical. Every tooth has many canals, up to 4 kilometres. And the minerals are stored in these canals. And in his book, he documented it well. It's called Dr. Tesla Meets Dr. Schussler, because health also begins with the teeth. The body uses the bones and teeth as buffers for minerals. And when the body becomes acidic, the body goes here and pulls the minerals out of the bones and teeth, and then it went on. 3.5 or 4 years ago, I was at a congress in Frankfurt, and there we had a participant, and she complained that she bit on something at breakfast and had a toothache, and it didn't go away, and she practically dragged herself through the morning and said whether this device could help her there. I said, yes, we can give it a try. We had a thermal imaging camera, or a way to measure the temperature, and that is the starting point of this lady. We see that skin surface is 31 degrees at the time. So the device wasn't calibrated, but you can see 31 degrees outside temperature.
Is that a normal skin temperature for now?
Yeah, from the outside. And then she irradiated herself for half an hour. And after half an hour, we measured again and got a temperature of 37.7 degrees. That means because the disturbance, the inflammation, was deeper, the body's now drawn the corresponding energy, and with more blood, more oxygen and more minerals, the body could then rearrange itself accordingly. The metabolic processes were improved and the relief was clearly there. Oh, now we have the pigeons. The relief was clearly there, that she really said after half an hour the pain subsided. It was almost gone. The next day, on Sunday, the congress went on even longer. She irradiated again in the morning, and on Monday she wrote that she no longer had a toothache.
Incredible, unbelievable success. Pierre, how is it here at the cell energy centre in Mallorca. Do you have such successes to show?
Well, I've had extremely high success in connection with upcoming dental operations. Well, I've got 3 or 4 really blatant cases. A woman, 63, had to go for a dental implant and get a jaw augmentation operation. That means nothing more than that the jaw was open for 3 or 4 hours during the operation. And they told the woman in the clinic that she shouldn't imagine that she would be able to see any people the next week because a lot of swelling and so on. And she was with me before the operation, and I said that it was very important to come to me after the operation. So she came, and we irradiated the jaw on both sides for 45 minutes. And the day after, that jaw was maybe 2 millimeters swollen. And all she had was a blue bruise. And I've such cases. There was a Spaniard who had 3 wisdom teeth pulled, giant cheeks surgery on another woman. So a lot of such cases, and the result's always the same. When they come back to the dentist, they say, "We've never seen a healing process like this," or someone said 1 in 100 patients had such a healing process. And I personally have a certain theory of why this is so extreme. With this cell tuner, it's a fantastic invention, maybe the best ever, honestly. First of all, we optimise the blood flow rates, that is maximum oxygen supply. But if I want to have optimal flow rates, then I also have to optimise the immune system and everything it does. I also optimise that for wound healing, to kill germs. For example, hydrogen peroxide then comes immediately. You know that from bleaching your hair, but it's a panacea that the body produces itself and sends to the wound area, so that all germs, bacteria, viruses and so on are killed and neutralised. I now have the H2O2 there immediately. Then H2O2 has a neurotransmitter function for the immune system. Then chemical warriors also come along. And the real point of rapid wound healing, and it really comes into play with the teeth, is if I have a wound, normal cell division wouldn't be enough for me. So, what to do? What do I have to do? I need more stem cells in the area in order to speed up the healing process, because I need a lot more cells. What does the body do? The nerve endings in the wound area send electromagnetic signals to cells that have already been specified. They reform in stem cells, and now we can multiply the cells. And I assume, because otherwise this healing speed would be impossible, that by using the cell tuner, precisely these impulses are available to the body. That we have a lot more stem cells to accelerate the wound healing process. Enormously. I can't explain it to myself any other way.
Arthur, can you explain how this miracle device works?
As I understand it, it has a certain function. And I also went back in history and did some research. What was there 100 years ago? And that's when I came across a man, Professor Ewald Paul, who was the head of high frequency and light research in Bavaria. And he'd written various books. And one of his books is High Frequency for Dental Practitioners. That means they already had high frequency interference back then, and were able to correct pain in the tooth and in the jaw area successfully. And what they did back then with their equipment, we repeated. That means if you are at the dentist today and they find the tooth is dead, what does this mean, Pierre? This means that the tooth doesn't react with the cold test. Why is this tooth not responding? Now the dentist goes ahead and pulls the tooth out. You will then get a denture. And then, before the tooth was extracted, we applied the hand probe to this jaw for several days. And after 5 or 6 days, the patient goes back to the dentist. The dentist does the cold test again, and lo and behold, the tooth reacts. This means that the conductivity of the tooth is restored. Through what? Through the minerals. Because due to the increased flow rate of the blood, where more oxygen, more minerals get to the tissue and the root, the tooth is filled with more minerals. And the tooth doesn't have to be extracted. And they discovered that over 100 years ago.
And we've now brought it back to life, that knowledge.
Exactly, brought to life, which means that whenever you have problems in the dental area, you use this high-frequency handheld probe at the point for half an hour per area and repeat that and the inflammation also goes down again. This means that these blockages dissolve after 3, 4, 5 sessions as a rule.
Now, it is said that every tooth is also connected to the organs. Pia, one of your specialities is the dental focus. And you say a dental focus can actually be 4 or 5 kilometres long. And because of this, we can have organic problems, which are then caused by problems in these foci of teeth. First of all, can you explain to us what exactly the dental foci are?
Well, dental foci are actually the following. We'll show that later. If I have a root canal treatment now, and then the tooth is drilled through and then dead tissue is taken out of it, and maybe is also getting disinfected. But every tooth has mini tubules, mini tubes that are 4 to 5 kilometres long per tooth, and one can hardly imagine that. Now, of course, it's very easy as a dentist, I can't do it all, take all dead tissue out of here. And then I have an excellent nesting place for microbes and bacteria. Now, the following can happen. That microbes and bacteria settle in. Now comes the point. They don't have any oxygen down there, they then mutate into anaerobic functions. Bacteria can do that. And when they are like that, they produce toxins. There's a well-known toxin called thioether. This is one of the most toxic substances, apart from radioactive substances, that exist at all, and they can flow from there and go into the whole body. And also every tooth is connected to organs via meridians. So cell communication no longer works properly. But if we come to these foci now, specialists have said that 80% of all chronic diseases in humans, up to joint problems, are based on silent foci, so to speak, in the teeth.
So incredibly important, the tooth, much more important than we think. It's about a lot more than periodontists, tooth decay and all these stories.
It radiates into the body, and here we have another graphic that shows very clearly. We'll also show it for the audience. I think it's the best. Here we see a tooth focus, and how can this tooth focus affect? It can either affect the joints, or the hips, or the heart, or the shoulder, or can lead to a headache. And as long as the cause is not resolved, that person will always have problems for a lifetime. And I need this solution. And what does the dentist want to do? He can only pull the tooth out. Now, it comes down to wound healing. Can the body do it well or not? But in advance, we can use the hand probe on that area and remove this inflammation. So the bacteria that are in here now have a problem. The temperature is going up from 36 degrees to maybe 39, 40 degrees. The basis of life for these bacteria, for these pathogens, is withdrawn. The immune system recognises them and can remove them, and internal wound healing can take place. There's another very important point. These tubules are so small where these bacteria and microbes settle, antibiotics can't get there. And most of the white blood cells from the body's immune system cannot get there either. That means I first have to fight that with energy, and that's what the cell tuner does by creating an artificial fever there. And these bacteria, that's what the body normally does. The body creates a fever to remove viruses, bacteria, spores, worms, to neutralise everything that doesn't belong there. And we support the body to create a fever in the place where it has to go, because the immune system won't work and antibiotics won't work either. The interesting thing is you only have problems with one tooth focus. It gets extremely hot, you can measure it from the outside, you can feel it yourself. And on the other side, you have nothing, you hardly have any warming there. The hand probe itself doesn't get warm, it's only the tooth and jaw area, and you can even put your finger inside and notice that you have the warmth inside. So that goes in depth. Several centimetres in the jaw area. And the perfidious thing about these silent foci, they're therefore also called silent foci, you don't feel them, nothing hurts you, you have no inflammation, nothing. But it still poisons your body. And I've had an extremely blatant case. It was a man with inflammatory pulmonary fibrosis. It's about the worst lung disease imaginable, always fatal. And then, from a lung specialist, from a professor, he got the diagnosis, he still has 6 months. After 3 months, he needs a ventilator, and that's it. And he paid €3,000 for it and was sent home. Really great.
It's a bad diagnosis that also makes you afraid at first.
But there's simply nothing you can do about it. And someone thought, OK, there's a silent focus there as well. That silent focus poisoned the whole body. A Hungarian dentist was also involved, so we could neutralise this silent focus. The man, that was 3 years ago, he should have been dead for 2.5 years. Still works on his 12,000 square metre villa every day.
It's unbelievable madness what effects all of this can have that you don't even know about.
Just a network of nerves, which Pierre also mentioned. When you look at how the whole thing protrudes from the bottom into the brain, and then flowing down the meridians into the whole body. And yes, this networking is there. And if you take out a tooth now, it's like a clock. If you take a gear out of there, and as soon as you take a gear out of a clock, then the whole clock doesn't work. And we have a biocomputer here, which is adapted to each other. And there you cannot tear anything from the outside all of a sudden.
Let's get to the beginning of the teeth. Let's get to the milk teeth. My neighbours, for example, have a little child who has to scream loudly at night because the molars are coming. All parents know that. These are the months that one would like to forget the most. Everyone has little sleep and you are on your last leg. Could one also help a child who is getting molars?
What has been done with children so far? They get a necklace made of what?
Amber.
Made of amber. Why amber? Because the frequency is also supposed to bring some relief, radiation power. And we can start again exactly at these points. And through this warming that is there is automatically relief. And I can say from experience that if the pain is currently at 100% and now the area is irradiated for 10 minutes, then it's only 30%. And you can handle that well. You can still bear that better than obviously at a level of 100%. So within 10 minutes, 15 minutes, you will see a significant improvement. Especially when there's pain.
When you talk about children, the body is still small. We have to be careful not to overuse this body. Can the device also have side effects?
Well, children are anyway, when they're pure, relatively quick to regenerate because they still have very good cell water. And we even get tests as test reports where even premature babies that got the structured food from the incubator later, where they were outside, not long, 3, 4, 5 minutes of irradiation at the beginning, they caught up with their peers within a year.
Unbelievable.
Or one aspect, perhaps also very interesting, because there are those training devices on the market for muscle training, with muscle stimulation, with electrical energy. The point is simply that. Basically, the ions that are present in the cells align to the oppositely charged poles, then current flows. But there I have a disadvantage that these ions leave the cell and migrate to the pole. You have to prevent that, otherwise I'll have a change in cell content. What do they do here? It's so brilliant, the directional flow of these alternating current impulses, which is used here, changes several million times per second. And the ions don't have time to leave the cell. That means I have no change in cell content. That's why there's no overdose. And another aspect is the only thing that you really notice when, for example, you expose the body to radiation, heating can take place. But it's generally found to be very pleasant. But the antenna itself has no thermal change when it's switched on. It's just the response of the cells, if reparation processes are set in motion. Then heat is generated inside the cells. That's the only thing that happens there. There's no overdose, neither for children nor for adults, or very old people or very sick people, or even animals. It's exactly the same.
I was just about to say that. We might have something like a placebo effect. Have you already had any experience with animals?
Of course. Well, I've described it in my book, in the chapter about dogs, about cats, about horses, also from... Well, the horse had inflamed gums and was treated with a swelling for 5 days. And after 5 days, the swelling was gone and the gums settled down. We've documented that, and we have many of these testimonials. We've collected the testimonials, so for sure, 25, 30 testimonials from people alone who had acute problems. Or if you have a dental operation, for example, before the dental surgery and afterwards. And you don't need pain medication, you almost have no swelling. And I can report one case about a person's liver spot after the cheek has been irradiated. After 4 or 5 days, it lightened. And after 14 days, it was no longer visible. And luckily, we took photos of that before and after, because we wanted to show the swelling. And after 14 days, we could show that the liver spot was gone. Why is it called a liver spot? Because the disturbance comes through the liver. So the energy could then, because it was probably related to the liver could also be replenished with energy. And it could work better.
You have a lot of experience in your practice. What are the best experiences you have with regards to teeth and the device?
Well, people who also suffer from cysts in the jaw, horrific inflammation of the gums, receding gums, tremendous pain decreases. Inflammation regresses extremely quickly. But I think the healing processes after operations are absolutely outstanding. They're simply unbeatable and actually incomprehensible. You really have to say. I've only had cases like this, but countless acute injuries irradiate with the cell tuner as soon as possible, so that this cell shock cannot manifest itself. And then the tissue still remembers it and makes repairs faster. There's a good point that we've not yet addressed that I have with radiation as well. I make the body fluids hexagonal. That also means I have incredibly strong anti-inflammatory effects. I have incredibly powerful antioxidant properties, regardless of the fact that I basically supply my whole body with a lot more energy because there's another frequency on it that has basically the same vibration as the mitochondria, our energy centers. We have about 200 trillion of those. And we reach them with electromagnetic waves and supply them with energy through an in-phase frequency. This is called constructive interference. And then all the healing processes and everything is accelerated again because there's enough energy available. So there's an energy boost, which also benefits the immune system, the healing process and self-regulation everywhere.
So it's still an incredible device. If the viewer now wants more information on this, is there a website where you can get more information?
Yeah, go to quantisana.ch. There's a lot of information stored there. Documentation, experience reports. I can highly recommend it.
And do you recommend the site too?
Absolutely. You can get a lot of information about the books, about the equipment, the history.
Great. Thank you, Arthur. Thank you, Pierre.
My pleasure.
Thank you for watching. That was something about modern medicine with the frequency device. Stay healthy and maybe a little healthier with us. Your Martina Hirschmeier.